Hello everyone, today I'm going to present an evaluation of mHealth solution named MySugar, using persuasive system design as the evaluation framework. This is the outline of the presentation. So my search strategy is using Google and Google Scholar to find both academic and industry sources about mHealth solutions for diabetes management. In the end, I choose MySugar because it is one of the best diabetes applications. In addition, I employ persuasive system design or PSD model to assess the persuasiveness of MySugar. To begin with, diabetes is on the rise across the globe. Although it is ranked 7 as the leading cause of death in Australia, diabetes is a chronic condition that requires painstaking and effective self-management of lifestyle factors and blood glucose level to mitigate the risk of potential complications such as stroke and blindness. Furthermore, there is no cure for this progressive disease to date. Therefore, a clinically effective and engaging treatment is needed to support patients in managing diabetes. MySugar is one of the solutions to address that issue. So what is MySugar? Simply put, MySugar is a mobile logbook that enables all types of diabetes patients to track their daily habits, blood sugar, and medications in an innovative way. With a mission to make the diabetes success, MySugar offers all-around services to make living with diabetes less burdensome. By logging data into MySugar, users can track their efforts and endpoints to tame their diabetes monsters. In addition, MySugar is a credible medical product, as it carries the CE marking, has met FDA standards, and is registered as a risk class 1 medical device in the US and Europe. MySugar offers 4 main features to assist people in managing diabetes. Firstly, personalized logging and quick data entry. Users can easily input their therapy data as well as import the data from Apple Health, Google Fit, and IQCheck. Secondly, users can continuously monitor their past data, know how they are trending, and thus they can increase their awareness to control their blood sugar level better. Thirdly, users can export their data to multiple report formats, which can be shared to doctors and healthcare professionals when having appointments. The last one is MySugar Coach feature, in which users have one-on-one education with certified diabetes educators and obtain personalized advice. These are some of the applications and screenshots for the key features. Moving on, I will explain my analysis using PSD framework. This framework consists of 4 categories, and each category has 7 principles. Not all principles are used in the evaluation, as some of them are not aligned with the aim of MySugar. The first category is primary task support. Overall, MySugar complies most of the principles. For instance, in terms of tunneling, the use of gamification, which is Tame the Monster, can motivate users to reach the target behavior. Although users are asked what type of diabetes they have during the registration process, MySugar does not provide tailored information based on their diabetes type. Regarding the dialogue support category, MySugar also complies most of the principles. Given that MySugar team mostly comprises employees with diabetes, the design of MySugar is driven by what people with diabetes need. Also, feedback from its users. Furthermore, MySugar has an easy-to-understand interface. Only suggestion principle is not fulfilled in this domain. The third category is system credibility support. MySugar has covered trustworthiness, expertise, service credibility, real-world field, and third-party endorsement criteria. However, there is no evidence that MySugar has embraced authority and verifiability principle. Last but not least, regarding social support category, 3 principles that MySugar has not adhered are social learning, social facilitation, and social comparison. For social learning and social facilitation, even though users can share their entries via social media applications, the interaction is merely one way. In the final analysis, it is recommended that MySugar should provide tailored information based on the user's diabetes type, since its type needs different treatments. Also, recommended diets and activities so that users can manage their diabetes better. Furthermore, MySugar should provide links to the educative resources. This will enhance user insights on diabetes. In terms of social support, I recommend that MySugar should provide discussion forums for users to exchange ideas about diabetes management. Importantly as well, MySugar should provide information regarding comparison of performance in managing diabetes among users. Analogically, in our energy bill, we can see our energy usage compared with other homes in our area. This will let users know how they are going and influence them to keep motivated and enhance their diabetes management behaviors. These are the references, and thank you for listening.